Hi, hello. Welcome to those who are watching this on the replay. My name is Nurse Choma. I'm the founder of Choosing Nursing over at choosingnursing.net. And we are here to help you to succeed in your career towards becoming a nurse. If you are not already, you want to go ahead and follow me right now. Follow our page, Choosing Nursing. We're going to help you. We help individuals who are in route of pursuing nursing, people who are in nursing school, individuals that are trying to pass your NCLEX exam, whether it's your NCLEX RN or your NCLEX exam or NCLEX PN exam, nurses who are working, looking for jobs, as well as finally nurses that are nurse practitioners, right? You're either studying to become a nurse practitioner or you're en route and you're already working in that area and you need either some guidance as far as what to do to build your practice. So those are the people that we work with. If you want to learn more, you are welcome to visit our website, which is choosingnursing.net. And if you're not already part of our text message, so if you want to receive some free stuff, right? So you want to get my NCLEX Prep mini course, some free guides, some updates, exclusive promotions, things that I just don't always have time to, come on here and announce. Then you want to make sure that you are part of our text message as well. All right. So to join our text message, text the word nursing to 77948. All right, text the word nursing to 77948. You're actually going to receive what's the word I'm looking for? Some free NCLEX questions. So if you're in the process right now where you're, trying to prepare for your NCLEX exam, you need questions. I'm giving away free NCLEX questions, free PDF NCLEX questions where you can download them. So if you want to get those questions, text right now on your cell phone, okay? Do it on your cell phone. The word nursing to 77. Let me put like here. It's easier. Nursing to the number 77948. All right. So say hello. Hi. I see you. Welcome. Thanks for being here. Thanks for joining, watching the broadcast. I'm glad that you're here today. So this video, we're actually going to be talking about what are the recent updates, what are the recent changes for April 2020 concerning the NCLEX exam. And this is going to focus on the LPN exam specifically. But however, though, if you are taking your RN exam, this will benefit you as well to hear. Because especially if it's been a while since you took in your RN test. So we're going to go over what the changes are. All right, we're going to go over what those changes are. So if you think this is helpful information that somebody else would benefit from knowing, then thank you for sharing the video as well as inviting others to the broadcast. So let me go ahead and give me 1 second. Let me go ahead and share it myself so other people can receive it too. And we will get started. All right. And comment below while we're tuning in. Just say hi. Tell me where you're watching the broadcast from, city, state, or country, so that way I can get a feel of who's here and what where you're tuning in from. Put this here. Okay. And then, so comment below, say hi, don't be shy. Glad that you're here today. And we're going to go right into the information today. We're not going to waste a whole lot of time. If you are struggling with questions, like you really need help in the area of how to answer questions, strategies, like you're struggling with priority questions, delegation questions, just questions related to medications, like you're really struggling in this area and you want to get better, I would recommend our question bank bundle program. It's 3 courses and I go over how to answer questions in detail. So meaning that I show you the questions, I break down the questions, I tell you how to think critically, and then also as well, you hear the correct way to process the questions. And then there's assessments, tests that it comes with too. And also on top of that, I also go over different formats of questions, like management of care questions, what they typically mean, SATA questions, what does that look like, strategies for SATA questions, best response, right? How do you answer the type of questions? You get a whole bunch of strategies. So it's 3 courses in one program. That's why it's called a bundle. And you also receive 300 NCLEX questions that you take separately in the computer, like on your computer in our membership site. And you also get trainings to show you how to think more critically. Your scores with practice questions will go up. It will go up through the use of this program. If you want to learn more about it, we're doing a promotion this week. Type the word question, one word. All right, type the word question in the comments, and then check your your Facebook Messenger. Check your Facebook Messenger, and I will send you more information via Facebook Messenger. So I see you from LA. Is that LA or Louisiana? Is that LA or Louisiana? See you from LA. Hello from Texas. What part of Texas? Massachusetts. Hello. Houston, Texas. Hi. Where is that? Tutsville, Florida. Is that Florida? Okay. Never heard of that before in my life. Hi from Florida. Hello, Palm Beach. Y'all enjoying Florida, huh? Florida. I'm sure the weather is awesome there. All right. See you. Awesome. Okay. All right. So let's go into the changes. Okay. Let's go into the changes today. Pennsylvania. Oh, I know you're from Pennsylvania. Okay. Los Angeles. Okay. There we go. All right. Los Angeles. I see you from Los Angeles. Awesome. Okay. Good. So who's taking their LPN exam? Put 1 in the chat box. If you're in the process of taking the LPN exam sometime this year, right? You're planning on taking it this year, put 1 in the chat box. And then if you're taking the RN test, put 2 in the chat box. Hello, hi, Oklahoma. I see you from Oklahoma. Glad that you're here today. And don't be shy. Tell me where you're tuning in from. I'm still paying attention to that. Arlington, Texas. Okay, so we have a lot of Florida and a lot of what's what we're looking for? A lot of Florida and a lot of Texas in the house. Oopsie. Okay. All right, so I have some notes in front of me too. So if you're wondering what I'm going to be looking down at, let me do this too first. Well, that's okay. All right, well, hold on. Let me do this real fast. Ooh. Okay, so if you're wondering what I'm looking down at, I'm looking at my notes today. All right, so I see lots of 2s. 2 in 2021, awesome. 2, 1, okay. So like half and half. All right, Michigan, hi. Texas, hello. All right, Texas, hello. Connecticut, 2, okay. Awesome. Here, let me share this. I just wasn't do this one here. Okay. Okay, and okay. If you're ready, put ready in the chat box. Put ready. If you are ready, put ready in the chat box so we can get started. All right. Okay. Let me put this in here too, so people know about it. Okay. Georgia, California, Alabama, Illinois. Will this be available to watch later? It will be available for probably just a couple of days to answer your question, Michelle. Okay, at the end, ask me that question at the end as far as the accelerated program. Okay, yeah, ask me at the end. Okay, all right, so let's go over what these changes look like. So the first thing is that as far as okay, I see all the readies, awesome. So as far as the changes when it comes to this exam, so first we know that every 3 years is when they change and update the NCLEX exam, okay? And I'll talk about in general what this is and what it means, and then we'll go into more specific details, all right? Does that sound good? So every 3 years is when they change and update the NCLEX exam, whether it's the RN or LPN exam. They changed it with the RN exam last year in April, and then they updated it again, or are updating it again, I should say, this upcoming April. And then they're going to change it again in 2023, right? Which will be, with that one, the changes are going to be way more significant than it is right now. So first of all, I'm going to tell you, and if somebody could put this in the chat box, I'll try and put some notes, but that would be great if you could comment as well. The changes are not very significant, but they are still noticeable. Okay, so let me put this in here. Changes. The Bachelor finale is on. Oh, really? Is that what you're watching, Michelle? That's funny. Okay, so the changes are not hugely significant. Okay, but they are noticeable. Okay. So the number one, I'm gonna go over what are the like minor changes, and what you can do. You can write this down. The information I'm sharing with you today, I also downloaded from the NCSBN website as far as the specific minor changes that they're making as far as the nature of the test, not just the structure or the formatting of the questions or the way they grade it, but the actual nature of the test. So these are the minor changes that's as far as how the nature of the overall test is going to be based on specific categories. All right, so let me pull this up real fast. Okay, so and what I'm going to do, I'm going to see if I can copy and paste this for you guys in the comments so you know. All right, so if you ever downloaded the test plan for the RN exam or for the LPN exam, which I should recommend you should do that on the website, the ncsbn.org website, what they do is that they list out all the categories of the test: management of care, safety infection control, health promotion and maintenance, physiological integrity, coordinated care for the LPN exam, basic care and comfort, psychosocial integrity, reduction risk potential, right? They list all the categories out, and then what they do is that then they will literally list out exactly what is in each category as far as like the topics. Okay, so if you're wondering, I was weak in reduction risk potential, I was weak in basic care and comfort, I was weak in whatever, and I don't know what to study, that test plan actually tells you exactly what topics are in that specific category. So under the category, and this is actually on their website, they have a guide that's called the updates for the 2020 LPN exam. Like, it's actually called this, and that's where I'm pulling this from. So under the category of reduction risk potential, they added some new stuff that you need to study or learn. So you need to know how to perform a focused data collection based on the client condition. Now, in my opinion, I feel like that's always been on the test, but what I believe I'm understanding is that it's specific now to reduction risk potential. So let me put this here. So under reduction risk potential, okay, you need to know how to perform focused data collection based on the client's condition. So what does that mean? So one of the things that you were probably taught, hello from Jersey, one of the things that you were probably taught in nursing school or in general is head-to-toe assessment, right? Doing a head-to-toe assessment. So that's something that's been ingrained into your memory. The reality is that nobody does a head-to-toe assessment like that on the floor. Nobody has time to assess the everything, the cardiac system, the GI system. What we do is that we do what we call focus assessments. Okay, so a head-to-toe assessment is going to be, I'm covering everything, and I'm looking at their complete medical history. What drugs are you on? What does your family history look like? Right, that's everything. But a focus assessment is that I'm focusing on whatever you're there for. So if the diagnosis that they came in is because they came in complaining of chest pain, then a focus assessment is going to look like listen to their heart sounds, getting CBC, and then getting troponin levels, getting the EKG, right? Everything that's feeling their pulse, everything that's focused towards this cardiac issue. Another example, let's say they came in because of pneumonia, or they came in because usually we may not know what it is right away, but they came in because they're having some type of respiratory issue. So a focus assessment would look like listening to their lung sounds, right? Asking them how they feel when they're breathing, looking at their skin color, right? Checking to see if they have an infection, because that's still tied to if it's a respiratory infection, right? Whether it's their WBC count, whether it's their temperature, right? So a focus assessment is that you're focusing on what they're there for. So your assessment is going to tie to that main diagnosis, all right? That main condition. That's pretty much the summary or the simplicity of what that means. So you want to pay attention to key words. So keywords, if the question says focused data collection or focused words or the word focus period, then obviously you're looking for choices that reflects that. So if I'm asking other stuff such as their medical history and it has nothing to do with a respiratory problem, then you're asking too much, right? Even when it comes to the vital signs, we should be doing period, you should still be doing blood pressure, heart rate, temperature, and everything. But you want to be mindful to pick answers that are centered towards identifying and treating whatever that specific condition is. Okay, so that's the first thing. Second thing, number 2, is these are 2 things now under physiological adaptation. All right, physiological adaptation category has to do with your ability to understand mainly the disease processes. Okay, so how well do you understand the diseases? How well do you understand pathophysiology? How well do you understand anatomy? And it will seem intimidating if you're not confident with the total body systems. Okay, so there's 2 main things that you want to be aware of here. And once again, for the LPN exam, you need to be able to know how to assist clients that have wound drainage device removal. Okay, wound drainage device removal. Put this here in the chat box. Okay, clients that have wound drainage device removal. So what do we do if they have a device like a JP drain or just something that helps to drain the wound? What do we normally do? And how do we normally take care of that or manage that? That's what this is referring to. So being able to does it need to be sterile technique? Is it clean technique? And then also being aware that you need to monitor the output that's coming out. Just very, very honestly, very simple stuff. But just you have to be mindful of that. One of the things is being able to assist the wound drainage. And the second thing too is being able to assist in the care of a client with a pacing device. So there are some patients that will have a pacemaker, right? So you need to understand, okay, if they have a pacemaker, what are the nursing precautions that's associated with clients with pacemaker? And what should they be able to demonstrate that they know or understand about the pacemaker, right? So can they go through metal, right? Can they sleep on it, right? What should they be aware of that tells them that they need to have it fixed or it's not firing, right? Or it's not working properly, right? So being able to care for a client that has pacemakers. This is also important because if you look at a lot of LPNs, right, you work in environments where you're exposed to a lot of elderly patients, and a lot of these elderly patients, they're on pacemakers, right? They have long-term pacemakers. So the biggest thing is being able to recognize if the pacemaker is not firing for whatever reason, which it should show on the rhythm. And side note, you do need to know how to read EKG rhythms. And then also, is the pacemaker showing signs of infection, right? These are some of the things that's important. And then knowing that they have a pacemaker in the first place, right? Being mindful of that. So it's going to be evident in their chest, because their chest will be more protruded. Is it on the left side? Is it on the right side? Which side is it on? Okay, so that's number 2. And then let me see what the last one is here. Being able, this is under psychosocial integrity, okay? Being able to provide end-of-life care and education to clients. So to me, I'm kind of surprised, because I feel like, well, no, actually I take that back. No, that makes sense, because you deal with a lot of elderly patients. So this is the last thing you need to know under like the revisions, and this is under, they said this is under psych now, that it used to be under health promotion and maintenance, is being able to provide end-of-life care. Okay, end-of-life care and education to the patients. So what does the process look like for a patient that is passing away or that is dying? And of course, we need to be aware of what their living will says. We need to know any type of, what's the word I'm looking for? Attorney of power, right? Is there somebody in their family that we can designate all information to, right? If so, what's that secret word that we develop with them? And then also as well, what do we do in the process of them dying as well, right? Because there's certain things that we begin to remove all invasive devices. Do they qualify for organ life care? Do we talk about that with the family? These are the things that you want to be aware of when it comes to end-of-life care and education. And when it says education to the clients, I would say not just the clients, but also family members that's involved as well, right? So you got to be aware of end-of-life care. Okay, so those are the changes that they made as far as the revisions of the test and what you need to know and where it is under the categories. The second thing, number 2, is that now they're making the exam, the formatting of the questions is more challenging. All right, just not too much, but the formatting of the questions, all right, is a little bit more difficult. Okay, so if you see a lot, like for example, a lot of things that people talk about is like case study questions, or just different types or SATA questions. So here's the thing, all the questions, the formatting doesn't really honestly matter. What matters is how will you understand the content at the end of the day. So let me give you an example of follow-up questions, right? How many of you guys have heard about follow-up questions? Okay, so follow-up questions, this is what it looks like. And this is follow-up questions. What I'll say, here's what you should be thinking. That's what I'll say, all right? Because a lot of times people will say, well, what's the correct way to process the question? So here's the way that you should be thinking or interpreting follow-up questions. So let me give you a really good example. So let's say you have a patient, this is all my notes, let's say you have a patient that states, and then let's say they're newly diabetic, right? Or even if they're not newly diabetic, but let's say they're diabetic and they're newly diabetic, right? And they say, you know what, for dinner, right? They're talking to you, I'm going to just make sure, I'm going to eat extra cake and ice cream, and I'll just make sure to take more insulin than usual, right? So that would be, and then let's say that would be a perfect example of a follow-up, right? So follow-up would look like, okay, they need to be educated on how to manage their diabetes better. So follow-up is very similar to which of the following requires intervention, right? That's so like what throws people off with the test, it's not really the content, it's really like the way that they're wording the questions, and that's throwing you off, and that's making you think that it's harder, when really they're still serving the same purpose. So that would be a follow-up situation, because now they need follow-up on how to correctly manage their diabetes. So follow-up questions are looking for statements that indicate that the patient does not understand the instructions or the information that the nurse is providing. That is follow-up. All right. So when they tell you which of the following indicates, okay, the patient needs to be, or what would this be, like a follow-up situation? They want to see that you understand the wrong choice. All right. The choice, or I should say, which of these represent or implicate that the patient needs follow-up. The patient needs further teaching, right? Further education, further intervention. That's how we use that follow-up term. I follow up with the patient if I know something is wrong, right? And that's what they're implicating through those type of questions. Does that make sense? All right. So follow-up questions is all about, they're looking that you can see statements that indicate that the patient doesn't understand the instructions, or that the nurse is providing, or they just honestly just don't understand. And it's similar to which of these requires intervention. Here's another example, right? That's a good example. And that's one thing that a lot of people are saying often is case study questions. All right. Once again, if you find this helpful, thank you for sharing this video and liking the video as well. I hope that you're finding it helpful. And if you want to get the guide of free PDF questions, then simply on your cell phone, text the word nursing to 77948. All right, 77948. Okay, so case study questions. So a lot of people ask about case study questions. Okay, so once again, what I would tell you is that your foundation in the content is what will guide you when it comes to understanding what the question is saying. Okay, so a lot of times people say, well, how do I know what the question is saying? Or what if I'm overinterpreting it and that kind of stuff? How will you understand the content, and how will you understand what is the most significant thing about whatever the topic is, will influence your ability to answer the question correctly. So if, for example, if I have a patient that has diabetes, one of the significant things when it comes to diabetes is blood sugar control, blood sugar maintenance. So it's important that these patients understand, exercising, taking their insulin, checking their blood sugar, right? Anything that implicates blood sugar maintenance. Okay? So this is what will guide you. I'm telling you, this is what will guide you when it comes to answering questions. The questions are not really, it's not that it's hard. It's honestly, they're just using a different approach to see if you really get the content. That's really what it is. So don't be intimidated because the format is different. You have to go back to what you actually know, what you actually understand. So case study questions, this involves, and put this here, case study questions involves your ability to understand how to manage patient needs. Okay? Case study questions involves your ability to understand how to manage patient needs. All right, you're welcome. So here's the thing. Okay, here's what I'm going to tell you. Two things. In order to do well in this, there's two things. The better you can put yourself in your patient's shoes, the better you're going to do. That's one. Okay? The better you can put yourself in your patient's shoes, the better you're going to do with answering case study questions. And then two, the better you understand the condition, all right, the better you understand the condition or the problem, the easier these questions will be. All right, so let me give you an example. So, okay, this is about how to manage the patient's needs. All right, so this is twofold. So the first aspect we're looking at here is, okay, what does every patient need? Just think about, just first from a physiological standpoint, And really, this is the part where you're going to use that whole, Maslow's hierarchy of needs part, right? So this is the part where you're gonna implement Maslow's hierarchy of needs. All right, I misspelled hierarchy. All right, so every patient at the end of the day, they need to do what? They need to eat, they need to sleep, they need to be able to use the bathroom, they need to be cleaned, right? These are their basic needs. They need to be able to sleep, they need to be able to eat, they need to be able to be clean. So hygiene is important for them, right? These are all the different factors. And then you also tie that to whatever their diagnosis is. So let me give you an example. So let's talk about a patient that has heart failure, all right? So if I'm looking at the whole picture, you take your exam on Thursday, well, I wish you the best of luck. So if I have the whole picture, right? And let's say I'm looking at somebody that has heart failure, okay? And I'm thinking about their needs, okay? If they have heart failure, well, heart failure is a problem where the heart is not pumping correctly, right? So it's not pumping sufficiently, I should say. So because the heart's not pumping well, that results, depending on and if it's left-sided or right-sided heart failure, that results in a backup, usually of fluid in their lungs. And these patients, they have problems breathing, right? They're not really tolerant when it comes to activity. They have shortness of breath, right? They have edema in their legs and their feet, usually in their feet and their legs. So if I look at their needs, though, at night, because they need to sleep, right? Because everybody needs to sleep, they need to eat, they need to be clean, they need to be able to go to the bathroom. So at night, when they try to go to sleep, they're going to, if they lay back, right? If they lay back, then that means all that fluid, because I understand the diagnosis, right? All that fluid in their heart, in their lungs, is going to literally rest on their chest. So they're going to have problems sleeping. So they're going to drown in their fluid. So therefore, I need to make sure that they have enough pillows behind their back. So I'm going to put enough pillows behind their back, and I'm going to count the amount of pillows that they use, because that influences how well they can sleep, which is one of their needs. Also, because they have so much fluid in their lungs, I want to give them Lasix, right? Or some type of diuretic, depending on what the doctor ordered. So I'm going to give them these diuretics, which is what's going to happen when I give the diuretics. The diuretic is going to cause them to lose the fluid, right? And they're going to lose that fluid. But here it is, their needs is that they need to use the bathroom. So because they need to use the bathroom, that means that they're going to get up frequently to go to the bathroom. So if my patient is elderly, is confused, is a fall risk, then I need to prioritize either having like a bedside commode, putting the patient putting the patient in a room that's near the nursing station, educating the patient, educating the other staff to make sure to go into the room first to see that patient, or I need to see them first. That's how you prioritize their needs. So you take what you understand about the diagnosis, and then you have to tie that with looking at the picture of your patient, which involves, right, they have to sleep, they need to eat, they need to be able to use the restroom, they need to be cleaned, right? And in addition to this too as well, if I have a patient who is like bedbound because of, let's say they're bedbound because of pneumonia or some type of condition, then they're not getting up as much, right? They're not going to get up as much and everything. So now they need to be turned, right, more frequently. So it's influenced. So your ability to anticipate their needs, it's based on how well you understand the picture of your patient. You put yourself in their shoes. That's why the answer is obvious when you know, well, okay, what do you do first? Well, put yourself in their shoes, and then also think about the path of that disease. And when it comes to diuretics, we don't give them at night. Absolutely, that's correct. We usually give them at 9 in the morning, right? We usually give them in the morning, and then by the time they'll probably pee all day, and then hopefully they won't have to use the bathroom as much at night. So the timing that I give the drugs, I'm thinking about that too, because I know the patient needs, because they have to sleep at night too. Does that make sense? Do you see how this is all connected together? So like I said, the better you can connect between you look at the needs, the overall needs of any patient, and then you also attach how will you understand the diagnosis, the case study questions will be easy and obvious. What people do wrong is that you have a very linear focus, so you're trying to recall only the disease process, but you're not really thinking about the needs of the patient, because you're not putting yourself in their shoes. You're just trying to answer Mr. Heart Failure, Mrs. Pneumonia, right? Mrs. Cholecystitis. So because your mind is so focused on the diagnosis and not also the needs, that's why there's a gap with how you understand and how you answer the questions. Am I talking good? Is this making sense? I hope that what I'm saying is helping you so far. All right. And to those of you that are just tuning in, welcome. Thank you for watching the broadcast. My name is Nurse Choma. I'm the founder of Choosing Nursing over at choosingnursing.net. If you find this information helpful, please definitely follow us right now. I promise you, I give you great information. You're also welcome to share the video as well with those that you believe would benefit from this information. If you want to receive our free guide today, so I have a free NCLEX questions that I'm giving away, and literally you're going to get questions and everything. I'm going to send them out via email. To get the free questions, you have to go through your phone. So on your cell phone, you want to text the word nursing. All right, text the word nursing to the phone number 77948. All right, nursing to 77948. Once you send that text, what I'll do, I'm going to send you the link so that way you can be able to download and get access to our question bank guides. All right. Okay. I'm glad you find it helpful. And like I said, our question bank bundle. If you found this one video helpful, there's several trainings where I go over all this. Like literally, okay, here's how you answer priority questions. Here's how you answer static questions. Here's how you answer, like literally, it's like trainings after trainings where I go over this. And on top of that, you get assessment tests. And on top of that, you also receive questions as well, where you can take the questions on your computer as if you're like doing the real thing. It comes with the answer key. I go over how to think more critically, how to change the way you look at the exam, and then also how to break it down. So I just break it down one by one. Like, here's how you break down the question, right? Here's how you really break it down. Okay, you'll find it very, very helpful. People have seen a huge difference in their practice exam scores from our question bank bundle, and it's definitely helped them to pass their exam, whether it's the RN test or your LPN exam. We are doing a promotion right now where it's 15% off. If you want to learn more about the question bank bundle, simply type the word question in the comments, and then I'll send you more information via Facebook Messenger. If you don't have Facebook Messenger or you don't use Facebook Messenger, then just visit our website, go to choosingnursing.net and click on NCLEX Prep, and then use the code PASSNOW. Here it is, and use code PASSNOW20 to get 15% off. Okay, that's what I forgot right there. Oh, no, to get 20% off. I'm sorry. Okay, to get 20% off of the bundle between now and Friday. Yeah, Friday at midnight. Okay, all right, here's the last two things and I'll be done today. So this is to those of you that graduated years ago, okay? To those of you that graduated years ago, here's what I'm going to tell you. If you graduated, so the longer that it's been since you finished nursing school, okay, the longer that it's been since you finished nursing school, it's going to be more difficult taking this test. There's no way around that. This is why you have to, what's the word I'm looking for? You can't just rely only on textbook only. Okay? You cannot rely on just textbook only. You have to expose yourself to the clinical world. All right? It's not going to be as effective anymore to just read a book. It's not. You have to begin to like literally like dive in, you know? So what I mean by this is like, okay, watch videos on YouTube if you can. We have a YouTube channel, but watch videos on YouTube of, you know, somebody putting a Foley in, somebody starting an IV, right? You know, like watch the videos, like see the actual clinical work. And then the other thing I would always recommend, and I would highly recommend this, is to volunteer at a hospital. If it's been at least 2 or more years since you finished nursing school, try and volunteer. Like, you need to be exposed to what nurses are really doing. You need to see the IV bag. You need to see the primary bag running in the patient's room. You need to see why the nurse is charting after she did X, Y, and Z, right? You need to see, right, how the patient's status just changed suddenly and what she did or did not do. You need to see all that. It's not enough to just read a book anymore, right? You're relying on too much. There's some things, I've told this to somebody else before, there are some things, honestly, that are caught, not taught, right? So you can't self-teach yourself anymore. It's, even if you go through a 3-day review, it's not enough. Let me put it like this, it's ideally not enough. You want to infuse yourself in that environment again. So go to volunteer at a hospital. Really expose yourself. Watch YouTube videos where you see nurses actually doing clinical stuff. But do not, I repeat, do not just rely on books only. It's not enough because of the changes of the nature of the exam. Okay? Okay, here's the next thing, the last thing, number 4. There's more coordinated care. It's the last one. / management of care questions. All right? There's more coordinated care and management of care questions on the test. So what that means, and this is more so a focus on cultural, this is what they did with the RN test as well. Cultural changes, okay? So cultural issues, I should say. And then implications with healthcare practice. Okay, so you need to familiarize yourself with cultural issues, right? So definitely, oh, you work at a hospital? Good, awesome. With people that so you got to familiarize yourself, right, with culture issues. So here's the thing. Things have changed now where, okay, remember the test is trying to implicate how the reality is. Back in the day, usually people don't want to go to the doctor, all right? People don't want to go to the hospital, right? But things have changed now where now you see more of a variation of different ethnicities, and it's more and more that are coming into the hospital, right? That's going to see the doctor, that's getting treatment, etc. And because the hospital has to meet like JCAHO standards, because the hospital needs to meet core measures, because the hospital needs to meet, you know, patient compliance. If they don't meet those things, right, by not being sensitive to certain patients because of their ethnicity, they won't get funding. They won't get money. So the exam is putting that into the test. Because now there's more patients from different ethnic backgrounds that have different needs and different things that they expect. And this is one thing I'll tell you right now. The reality is that people expect you to respect their culture and know their culture. Oh my goodness. They expect you to respect their culture and automatically just know it. No, you should know. How come nobody here, doesn't speak our language? This is wrong. This is ridiculous. That's the reality of it, right? Like people, I'm leaving the hospital. We're going to sue the hospital, right? That's how a lot of patients do honestly respond. So for that reason, though, we have to be more sensitive to different cultural backgrounds. So you want to take the time to learn different things. Like I believe on our page, I put like books that I recommend. Like if you want to see the books I recommend, as far as like, okay, different books on different topics, like because I get a lot of people that ask me what type of books you recommend for RN review, for LPN review, for culture sensitivity, for prioritize, all that kind of stuff. We have a website called books.choosingnursing.net, or that's our store, books.choosingnursing.net, and I list out all the things that I recommend as far as different books. But you got to expose yourself to more cultural issues. So people that have Hindu or Muslim descent, what are their normal practices, right? What do they accept and what do they not accept? How do they deal with the death of a patient? What are their rituals? You got to know that stuff. Okay, you got to familiarize yourself with that kind of stuff. People of Asian descent, what's their normal practice, or how do they handle care in the hospital setting? And from one thing that I remember learning, or let me say this, from one thing that is usually pertinent for many people of like of Asian or culture or Chinese descent, is that they're not fond of pain medication. So I remember when I had a patient that was in a car accident and he was in a lot of pain and he had a halo brace. He was from China, no pain medication. He refused it all throughout the shift. So if you as a nurse, if you're not sensitive to that, you're gonna be like, hey, what's wrong with you? Take the pain meds, take the pain meds. You're gonna be pushing something that's not within his norm, right? So that's the reality today, is that you need to be aware of, you work in public health, you need to be aware of the cultural sensitivity and practices of your patients. Okay? All right. That concludes today's teaching, actually. I hope that you found this helpful. If you did, thank you for watching the video. Like the video, heart of the video. If you want to give me stars as well, that would be great. If not, like I said, if you want to get the guide, make sure that you type the word. I'll send it via Facebook Messenger as well. But if not, you can type the word question for more information about the question bank bundle. Use the code PASSNOW20. And then if you want to also join, if you want to get the guide on your cell phone, text the word nursing to 77948. Nursing to 77948. Tomorrow I'm going to go live at the same time, and I'm going to talk about how to master SATA questions. Yeah, right? So this is a huge topic. A lot of people really want me to talk about this. So how do you select all the apply questions? I will talk about that tomorrow at this same time. So meet me tomorrow at the same time. Get the guide, text the word nursing to 77948. For the question bank bundle, type the word question. And yeah, that's it for today. If you have questions about anything I covered, please let me know. You can inbox me here on the Facebook page. All right, and then if you want to learn more about myself, just visit our website, www.choosingnursing.net. All right, any questions before I head off? Let me answer one more question. Did you guys find this helpful? I'm glad you found it helpful. I hope that you found it helpful. Hope that I gave you some instruction for today. All right. Let me see. Did I do this here? Did you guys find this helpful? Okay. All right, you guys. Thank you for watching. I'll see you tomorrow at the same time. All right. Bye-bye.